Hello, I'm Dr. Lourdes Auroso. I'm a sleep physician, and I have dedicated many years of my career to the diagnosis and treatment of restless leg syndrome and restless sleep disorder in children. Today, September 23rd, we have dedicated to the awareness of restless leg syndrome. So today I'm going to talk a little bit about restless leg syndrome in children. We wouldn't think, but restless leg syndrome is quite prevalent in children. In the general population, it's estimated to be only 1 to 2%. But in children with some other disorders, such as autism spectrum or ADHD, is higher. Look, in ADHD can be up to 44%. The diagnostic criteria of restless leg syndrome in children is difficult to assess because usually we think of these four diagnostic criteria to diagnose restless leg syndrome in anybody. The urge to move the legs, worse when we are in situations of rest, like right before bedtime or when we're in a movie theater, we have that urge to move the legs. Gets better with movement, so when people get up and start walking around, symptoms usually get better, and the symptoms are worse in the evening. Now imagine, this is a mnemonic, by the way, urge. The urge to move, rest makes it worse, gets better with movement, and worse in the evening. So just to remember the diagnostic criteria with the mnemonic urge. But can you imagine in children, small children, 1 year old, 2 year old, or children that have difficulty expressing their feelings, how difficult it really is to make the diagnosis? Most of the time, I rely on the parents. The parents tell me that the child has fidgeting in the legs, or at night they have to rub the legs. Many parents ask me or tell me that the children love for the parents to rub their legs at bedtime, and that should be suspicious of restless leg syndrome. Also, if the children are really fidgety, move a lot their legs, move or kick during sleep, or have difficulty falling asleep, as we're going to see. So, in children who have difficulty expressing these feelings, supportive factors are important, such as family history. So, if a parent has history or a mom has history of restless leg syndrome, that makes it highly suspicious in the setting of symptoms. If there are what we call periodic limb movements during sleep, this is leg kicks that are sequential that we usually see during the sleep study. But sometimes the parent tells me, yes, my child kicks during sleep a lot all night long. And if there is presence of iron deficiency in children and they respond to iron treatment, that is also quite supportive of the diagnosis. Also, when we think about restless leg syndrome, a lot of children will kick in their sleep in what is called periodic leg movements of sleep. This is a continuum. So if your child has a sleep study and it shows an elevated index of periodic leg movements or limb movements, periodic limb movements of sleep at night, that could be a supportive factor of restless legs, as the majority of children and adults with restless leg syndrome will show periodic leg movements during sleep. However, if the child or the adult does not have symptoms of restless legs, it is possible that there could be what is called periodic limb movement disorder. What is the importance of the evaluation of restless legs, and how do we sleep doctors evaluate? Well, we have a good clinical history. We assess if the relatives have restless leg syndrome, if there is history of iron deficiency, which has been associated with restless leg syndrome, symptoms of insomnia, difficulty falling asleep because of the fidgeting and the sensations. Also, comorbidities, like some of the disorders that have been associated with restless leg syndrome, like what we mentioned, kidney problems or autism or ADHD, and also the use of some medications that can exacerbate restless leg syndrome. Antidepressants are common. How do we evaluate? We usually get iron levels, hemoglobin, and some other laboratory that can help us see if there is a deficiency that can contribute to restless legs syndrome. Sometimes the symptoms are different by age. I'll try to find a little spot so you can see. So, The children can express different symptoms of restless leg syndrome, and this is a study very interesting that showed what those symptoms are and can report by age that they can have sand feeling or feelings like ants, tingling, itchy feelings, and it's not necessarily the adult urge to move. Like when we see at an older age, 16, 17, then the need to wiggle or the leg wants to kick or feels like moving, that's at an older age. But in a younger age, it's important to recognize these other presentation symptoms. It's important to know that restless leg syndrome is one of those disorders that is often undiagnosed for many, many years. And you can see in this chart how children had symptoms since infancy and they were diagnosed later at age 7, 11, or even older. I have published many manuscripts, papers, research papers in restless leg syndrome, and some patients included in the research started at age 1 or at age 2. And this is always the question from the reviewers: how did you know that this patient has restless leg syndrome? And every time I would look at my clinic day, there would be several infants or children with restless leg syndrome that needed to be treated. Here it's another chart that shows how the sleep disturbance actually can start from very early in infancy, and the diagnosis delays. The full diagnosis is made when the gray boxes, and the symptoms started with the light purple boxes. This is a interesting chart that we created and designed, and this is our publication, and it shows how the genetic background can contribute increasing the risk, but also there is the importance of epigenetics, the lifestyle, the lack of exercise in adults, smoking, in children sometimes caffeine, drinking caffeinated products, or high um, chocolate has a lot of caffeine, or iron deficiency as well, and living in specific situations. Also, medical comorbidities, as we mentioned, kidney and iron deficiency are the main important ones, but also other deficiencies such as vitamin B, D, magnesium can affect, and all of that interacts with the genetic background to show the symptoms or have the symptoms of restless leg syndrome. As I mentioned, genetics, and this is some information for those of you who want to or are interested in the genetics of the disorder. Also, the consequences, is really important to understand that the consequences of restless leg syndrome, if you have the symptoms at night and there's this urge to move at night, it can present with restless sleep, it can present with fidgeting, it can present with those symptoms, but also during the day. During the day, it can also be fidgeting, sleepiness, or hyperactivity, inattention, other symptoms. So it can affect both how the child sleeps and also the behavior during the day. Imagine a child with restless leg syndrome who needs to sit hour after hour in class, and it is called distracted or fidgety, but just because they have that urge to move their legs and they can't sit still for hours. So we need to identify it and treat it. This is another algorithm that we created in one of our publications that I led on restless leg syndrome and how to assess and treat depending on the comorbidities, assessing symptoms, comorbidities, and determining if there is anxiety, depression, or ADHD, which are comorbid conditions, and assessing iron levels. Iron has been the most important associated factor, iron deficiency, in the symptoms of restless leg syndrome. So when we find out that there are low levels of ferritin, and key information in this area is that sometimes for anemia, the ferritin levels or the iron levels are going to be normal. So your primary care doctor is not going to mention or identify that it's iron deficient, because the labs often do not show anemia, but show non-anemic iron deficiency. That is a ferritin level less than 50 for children, less than 75 for adults, and we will start iron supplementation either with oral iron or intravenous iron. And this is a chart about iron improvement with intravenous iron. Um, with most of our patients improve significantly with intravenous iron compared to very mild side effects from the infusion. So children who do not tolerate oral iron, who have significant side effects to oral iron, or who do not respond, the ferritin levels do not improve after taking 3 to 5 months of oral iron, then consider intravenous iron supplementation. This is some non-pharmacological treatment options, including, like I mentioned, stop caffeine consumption, exercise in the afternoon, avoid medications that worsen restless leg syndrome, such as antihistamines, anti-nausea medications, some antidepressants, and use non-pharmacological symptom relief, such as exercise, rubbing the legs, walking around before bedtime, good sleep hygiene, and massage and hot or cold compresses sometimes are helpful. Important, like I mentioned, iron supplementation. So, in summary, from this brief a reminder about restless leg syndrome and identification in children and treatments, it is a common complaint in children. It is commonly seen in various conditions, especially children with ADHD. There are many causes of restless sleep and restless leg syndrome as well. I did not talk about restless sleep disorder, but maybe for the next video. And also, restless leg syndrome can present from infancy, and iron is the current treatment for both restless sleep and restless legs syndrome. And that's all for today. This is Restless Legs Syndrome Awareness Day, September 23rd. And please feel free to share this video. Identify restless leg syndrome in children is going to change their life, improve school performance, improve attention, daytime behaviors, and it's really going to make a big difference. Check iron levels, supplement iron, and next time I'm going to talk a little bit about restless sleep disorder, but today let's focus on restless leg syndrome. Thank you.